Good morning. If you have decided to study and you want to become a professional hypnotherapist, keep watching our training videos about clinical hypnosis. Hypnotherapy is an effective technique with which you can help and improve the quality of life of a great number of your future patients. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis, and also you can download several ebooks also free. The information in this video is extracted from our book Direct Clinical Hypnosis, Deep Hypnosis, of our publisher Clinical Hypnotherapy, registered with ISBN. Direct Clinical Hypnosis, Suicide Treatment, Part 2. Anonymous Letter. I don't want to go on living. I'm 41 years old. I consider myself intelligent. My cultural background is white, and my social status is medium-high, and I am agnostic to the core. I am not writing this out of occasional frustration or because of a difficult moment in my life, but the fact is that I am very tired of the life I have had to live and very scared of the one that is about to come. It's easy, it's simple, and it's like this. I don't want to go on living. Some will call me coward. Some will call me dissatisfied. Some will call me stupid. Some will think that I speak out of disillusionment, depression, or lack of stimuli. Surely, some will believe that what I need is encouragement and arguments to prove to myself that life is worth living, and others will support me in my decision. Some will call me a coward. Some will call me dissatisfied. Some will call me stupid. Some will think that I speak out of disillusionment, depression, or lack of stimuli. Surely, some will believe that what I need is encouragement and arguments to prove to myself that life is worth living, and others will support me in my decision. It does not matter. I'm not looking for understanding or a shoulder to cry on. I will not try to give reasons to support my suicidal motivation, because only I am affected by my problems, and only I suffer them on my skin. If for some there is not anything important enough to deny the gift of life, I'm happy for them. But they are not important enough to deny the gift of life. I'm happy for them. But they are not me. They do not live my life. They do not suffer or endure my anguish. From the outside, it is easy to judge and try to understand, but it is not understanding or help that I seek. For now, this writing is just pure venting. I'm a coward, I admit it, because although I have the idea of suicide clear in my mind, I do not dare to do it for fear of physical pain and for fear of not achieving it and making my situation even worse. If today I had in my hands one of those famous little cyanide pills, quick and painless, I would not take it. I would not take it immediately. I would keep it as a treasure, because it would be the key to end this at the right and necessary moment. Now I am bad, but what scares me most is what is to come, and when that time comes, I want to be able to refuse to continue suffering. Today I can write, today I can think, tomorrow I don't know. Greetings. Another letter. I'm fed up with my life. Sometimes I try to drown myself in the pool. I hold my breath underwater until I feel that I can't take it anymore and that I'm dying for good. I let myself go, but then an impulse makes me get out, makes me think that maybe this day will be different and that I must leave it. But no day is different. I feel lonely, dirty, and desperate, thinking that in the years to come, no one will look at me in a good way. No one will believe that I can be something serious. Everyone thinks I'm a whore. Everyone thinks I'm scam, shit. Today, while everyone was talking and I was just thinking that there should be an escape for me, I needed something that would make me feel happy, something that would make me feel good, something that would make me feel happy. I needed something to make me feel happy, radiant, powerful, like before, drugs, maybe alcohol, something. I need something, please. Well, it so happens that my sadness is not only because of my reputation, but because I found out that a son of a bitch came into the room where I slept when I got drunk the day of the party. When I confronted him, he told me that he had only groped me, that I had left him very excited, that he did try to grope me, but that I was very closed and he was very drunk. He apologized, but I insulted him. I hate him. He told me so coolly, as if it was something normal. That's why my belly hurt, because of the beast's attempt to make me his. He gave me a joint, and I drank too much at his party. I never wanted to be a whore. I always wanted to be good and to be loved. I always wanted to be loved. This is what a joint and drinking too much at a party has led me to. Now I feel dirty, very dirty, so dirty that I only think of suicide as the only way to escape. I don't know what I can take. I have no idea. I only know that I'm desperate. I see no way out of this situation. I have a feeling that the end is near, if it is the end. Many people think of suicide because it seems to them that they have no other resources. For them, in this moment of despair, death is the world, and we must not underestimate the real, strong, and immediate despair that leads them to think of suicide as a last and only resort. Suicide is often a permanent and false solution to a temporary problem. When we are depressed, we tend to focus on things from a very narrow point of view, tunnel vision. With the passage of time, a week or a month, things change completely. Most people who have ever contemplated suicide are subsequently glad to be alive. They say they did not want to end their lives. They simply wanted to avoid grief. The negativity can range from irritation or even impatience to fiery anger, from a state of depression or resentment to despair, and eventually into the fatal spiral of hopelessness that leads to suicidal ideation. As the only solution to the problem the patient is going through, negative thoughts give rise to negative actions that are preceded by anger, frustration, or hopelessness. Survivors. The loss of a loved one by suicide is a terrible, painful, and unexpected event. It is estimated that 1 million people worldwide commit suicide each year, and more than 20 million attempt suicide. In addition, the lives of surviving family and friends are profoundly affected. These are known as survivors. Survivors are the family members or loved ones of the person who has committed suicide, who suffer intense and prolonged grief. They even have obsessive thoughts about the motive for the suicide, as well as thoughts of guilt, both their own and those of others, about whether they could have done more to prevent the suicide or helped their loved one more. This further complicates the grieving process. because of the great stigma attached to suicide. Survivors are often reluctant to tell their story openly and express their feelings. The best thing to do is to listen to what the survivor is telling us without criticism, prejudice, or value judgments. We must put aside all our preconceived beliefs about suicide and suicide victims. First of all, we should ask him or her if he or she wants help. He or she may not yet be ready to share his or her pain and may need some time to accept help. That is why we have to be very patient. What the survivor needs is our presence and, above all, unconditional listening. We must let him speak at his own pace, without putting pressure on him. Repetition is part of the coping process. We may have to listen to the same story several times. We should use the name of the loved one instead of he or she. In this way, we humanize the situation more, and above all, it is more comforting. Surviving children also grieve. They experience the same range of feelings as an adult, so it is a myth that children do not grieve. The expression of grief may be different from that of an adult, as children have fewer resources than adults to communicate their feelings. It is very important to note that children are very vulnerable to feelings of guilt and especially feelings of abandonment. It is therefore vitally important that they do not feel guilty about the loss of their loved ones. We have to reassure them that they are not to blame for such an unfortunate loss, and of course, reassure them that someone is going to take care of them. We must explain the situation to the child and answer their questions in an honest and age-appropriate way. If you're interested in learning more about clinical hypnosis, watch our next video, Direct Clinical Hypnosis, Suicide Treatment Part 3. Remember, with the description of this video, you can find a link to free training classes on clinical hypnosis, and also you can download several ebooks also free. If you have any questions, add them in the comments area. On this topic and many others we'll talk about in the channel and in the videos that we'll publish. So, if you're interested, do not miss our next videos. Thank you very much.